Hello, I'm going to be talking to you about blepharoplasty postoperative information and care. So blepharoplasty is eyelid surgery. Oftentimes we'll do upper lid blepharoplasty in the office or upper and lower or just lower in the operating room. So after blepharoplasty, I'll talk about, say, maybe the upper blepharoplasty first. Overall, upper blepharoplasty is an easier surgery to recover from. It's less surgery. In many ways, it's kind of less invasive. So afterwards, you'll notice your incision in just kind of laying in the natural crease. This incision will extend from the medial canthus area all the way over and then into the crow's feet. Those stitches will need to be kept moist. We give you an antibiotic ointment that we want you to use throughout most of the week. If you run out of the antibiotic ointment, you can use like Aquaphor or Vaseline. You just need to be careful that that doesn't get in your eye because that would be an irritant. So one of the kind of first things we say is keep them moist with the ointment. The probably most important thing is icing. So you want to ice those incisions for at least 24 to 48 hours. You want to keep it kind of as cool as you can for as much of the time as you can to cause vasoconstriction, meaning the blood vessels kind of constrict because of the colder temperature and decreases the risk of bleeding at the site. Now, you definitely don't want to put ice directly on the skin because that's obviously too cold. What you'd probably want to do is have ice water with little gauze sponges that you change pretty regularly, or something like a wet face cloth or cloth with some ice like frozen peas on the cloth. So your skin's not directly having the ice on it. But we sometimes will say 20 minutes on, 20 minutes off, 20 minutes on, 20 minutes off. That's probably the most important thing because the biggest theoretical risk is that blood collects under the incision and gets a hematoma, which is it kind of swelling and ballooning up. Now, apart from the icing and the incision care, it's important to know that you will get a lot of swelling and you will get bruising. The swelling is really kind of the whole upper lid area, and the bruising can actually come down, extend onto your cheek. So even though the incision's up here, the bruising can actually be down here, which sometimes surprises people. I'll give you some antibiotics to prevent infection. Usually you don't need any pain medicines. Tylenol usually is adequate for the upper lid blepharoplasty. I usually have people come back between 7 to 10 days to remove the stitches. There's usually a knot here and a knot there, and then it's a running suture. So we remove that at around 7 to 10 days. After that 7 to 10 days, you still need to be really careful of the incision. You don't want to have any shearing forces, forces that are causing it to spread open, because the skin theoretically is still kind of fresh and at risk for opening. So that second week, you need to be still very, very careful, particularly, when you're sleeping or if you reach up to your face to do an itch, because you'll no longer have the sutures in place to support the soft tissues. So you really need to be cognizant of it. In terms of normal activities, you could return back to normal activities usually by like a month or so, and kind of do a gradual progression. First week, very little. Second week, you can do some walking, gentle activities. Third week, you could do a little more, like some stretching. And if you do activities like putting or, pitching, I don't play golf, so, subtle little things. If you play basketball, you could shoot some basketball. You could, hit some gentle ground strokes, with a friend, but nothing where you're running or anything like that. And then by a month, you can kind of resume normal activities. You'll see swelling that will last, really weeks to months. It's going to take a little while for the site to calm down. But for the most part, within, the first month or so, things look pretty good. the scar will slowly fade and will eventually be in that natural crease, so it won't really be visible. So that's the upper lid. Oh, one other thing is medicines. Make sure you don't take any blood thinners like ibuprofen or other NSAIDs like Aleve. And also don't take any aspirin for the week following the surgery, just in case, because those increase the risk of bleeding. So lower lid blepharoplasty is a whole other thing in terms of kind of how much swelling and the postoperative course. When you manipulate these lower lid tissues, and we either make an incision here or go through the inside of the lower lid, you get a lot more swelling. And the swelling can really last for months. You know, it's not going to be a week or two. It's going to really be a while, and you have to mentally be prepared for that. The care, for the most part, is the same. It's that same antibiotic ointment we give. You can do the icing and, you know, the pain medicines and antibiotics. But the big thing with the lower lid blepharoplasty is the swelling. In the lower lid blepharoplasty scenario, you sometimes will also need saltwater, natural tear type eye drops that will just kind of keep the eye moist and soothed, you know, so it's not irritated. Like the upper lid blepharoplasty, the biggest risk of this is also bleeding. So you want to do the icing in the same way that I described at the beginning of the video. One thing for bruising that can be helpful for some people is Arnica montana, which is an herbal supplement that sometimes I think people feel decreases bruising at the site. So that's something that you could consider. For the lower lid blepharoplasty, I see people back at a week, take out the stitches at that time. Another thing that sometimes can be present on lower lid blepharoplasty is you might see little stitches or stitches with gauze or stitches with little pieces of rubber kind of on your cheek here. And I do that sometimes when I'm repositioning fat. So if there's extra fat up here, I sometimes reposition it, and those sutures are holding it in its new place. Those will be removed at the time of the first postoperative visit as well. So, but those can look a little weird, and sometimes people don't really understand what's going on with that. So in summary, for blepharoplasty, icing is the most important. And you don't want to do direct ice on the skin. You want some sort of buffer, moist cloth or something to kind of prevent it from getting too cold. Don't take any blood thinners for the week. Do your ointment and then just be relaxed. And then I'll see you back at 1 week for the suture removal and the operative site assessment. All right. Thank you.